Kia ora. I'll begin with some good news today. There are no new cases of COVID-19 to report in the community. That's despite over 16,000 tests being processed yesterday. I'll ask the Director-General to give more of an update about that shortly, but first, a quick update on our vaccination program. As of midnight last night, 9,431 people have received their first doses of the Pfizer vaccine, including over half of our COVID-19 frontline border workforce. More than 70% of those vaccinations have been delivered in the Auckland region, equating to 6,688 people. A fifth of those are Māori and Pacifica. Yesterday afternoon, we also received our third batch of Pfizer-BioNTech vaccines. That shipment of 65,500 doses arrived as air freight at Auckland International Airport, bringing the country's total number of COVID-19 vaccines available to date to more than 200,000. It means that from next week, we can get into the next phase of vaccinating the around 50,000 family and household contacts of the border workforces in our main centres. In regional ports like Nelson, Marlborough, the smaller workforce has meant that we've already been able to get this underway, as both the border workers and their families are able to be vaccinated using the same batch of doses. This is really good news, and it means that they're protected against, or they're more protected against the virus and ahead of schedule. The next group of people to be offered early access to the COVID-19 vaccine will be our non-border frontline health workers. We expect around 57,000 to be in that next group. This subset of that workforce are the people who deal directly with patients who may have COVID-19 and can be potentially exposed while they're providing the care that is required. So offering this group the opportunity to be vaccinated next will also help to protect against the spread to other at-risk communities that they might be dealing with. Finally, on vaccines, it does take an enormous amount of work by quite a wide range of people to roll out an immunisation program of this size. It's early days yet, but I do want to thank everybody who has been involved for helping to protect all New Zealanders from COVID-19. We have made a very strong start. I also want to thank everyone who's agreed to be vaccinated. You are protecting us as well as yourselves, and I want to acknowledge your commitment to our team of 5 million. So I'll now hand over to the Director-General for a bit more detail, and then we'll get into questions.
Thank you, Minister, and kia ora koutou katoa. Again, just reiterating, no new positive cases of COVID-19 to report in the community. Good news again today. There are 2 new cases in managed isolation in Auckland. One of these is deemed to be historical and therefore not infectious, and the other is a person who has travelled from India and is now in the quarantine facility in Auckland. I'd also like at this point to just thank all those who have been affected by the latest cases of COVID-19 in the Auckland community for their ongoing cooperation with isolation and testing requirements. I recognise it's quite an imposition on you and your whānau, and it is because of your actions that we can increasingly be confident through the week that we are getting around the outbreak. A reminder that all close contacts who are isolating at home must wait to be released from their isolation period by health officials, and they will notify you when that period is over. Our contact teams continue to work hard to follow up with all close contacts and other casual contacts so that we make sure they are tested at the right time as quickly as possible. I was asked yesterday about how the contact tracing system was performing, and I've got some information that for the period between the 14th and 26th of February, 87% of close contacts of a positive COVID-19 case were contacted within 48 hours from the moment that the Public Health Unit was notified of the case, contacted and of course isolated. And it's the speed of getting people into isolation which is critical to prevent further onward spread. And the latest contact tracing data, which will include in part this data from the latest outbreak, is expected to be published on the Ministry's website next week. As the Minister mentioned, a massive response to the calls for testing across Tamaki Makaurau, and I would like to thank everyone who has had a test. As the Minister said, more than 16,000 tests processed yesterday, and that takes the 7-day rolling average to 8,950. 11 community-based testing centres open in Auckland again today, many of which are in South and East Auckland, and a reminder also that most general practices and urgent care centres also able to do testing, and generally they do around 60% of the testing in Auckland. I would like to just take a moment to reiterate my comments yesterday about what people should do while they wait for test results. If you are symptomatic, wherever you are in the country, you should remain isolated until you receive your test result. If you are part of the being tested as part of the outbreak in Auckland as a close or casual contact, please follow the instructions of the Public Health Unit, and you should indeed be remaining home till at least you have the results of those negative tests. There will be different advice to different contacts depending on the nature of the exposure that they were, their exposure at the locations of interest. It does go without saying that our thousands of border workers who are being tested regularly, either fortnightly or weekly, because they are asymptomatic when they are tested, they do not need to isolate while the results of their tests are returned. But of course, if they are tested because they are symptomatic, they do isolate. And I just want to thank them for not only the work they are doing at the border, but the fact that they are putting up with weekly or fortnightly nasopharyngeal swabs as well to help keep all of us safe. Healthline continues to be busy and has got extra staff on to cope with that extra demand, 3,761 calls yesterday. Demand peaked between 7 and 9 in the morning with an average waiting time of 12 minutes. And for those who may need support, don't forget that the 1737 phone number is available with support 24/7. As I mentioned yesterday, last evening I took part in a workshop, a Zoom workshop organised by the Office for Ethnic Affairs with about 140 leaders from across a diverse range of communities. It was a discussion both on the response in Auckland at the moment, but also letting them know and answering questions about our vaccination program. So I just want to thank them for their great willingness to be involved in spreading the word out to their communities to help signpost for people to where they can get good information about the vaccine, to help counter misinformation. And I was also able to reassure Muslim and Jewish communities that the Pfizer BioNTech vaccine, the one we are using, is considered both halal and kosher. Information about the vaccine program has already been translated into 24 different languages, which are available on the Unite Against COVID-19 website. And the Minister brought his bottle of kombucha in. I did not bring a pizza box, although it looks like it. This is the box that contains, that goes out to our vaccination centres, contains up to 195 vials of the vaccine. Times 6 is 1,170 if my manual mathematics is still good. So that goes out containing up to 1,170 vaccinations. Inside it, and I can show this afterwards if anyone is interested, I have samples of the different, I don't have the vials because there's a security issue about having make-up vials or pretend vials, but I have got the different types of needles, syringes, and in particular the new low residual volume syringes, which we've just received 490,000 of those. As I've said before, our nurses have been able to get 6 doses out of every vial using just standard needles and syringes, but with these low residual volume needles, we'll be able to guarantee that to absolutely minimise the waste and make sure we make the most of every vaccine that we have. Thanks, Minister.
Thank you very much. Happy to open up for
Minister,
questions. We'll start back here.
With no community cases today, can we say with confidence we're through the worst of it, or are we still holding our breath for tomorrow?
I think we're still in the critical period where we're wanting to see all of the test results of all of the relevant close and casual contacts come back. So that work is still underway. There's still some test results still to come through for people who we really want to see the test results for before we can sort of breathe any kind of sigh of relief. So we're not quite there yet.
If we hit another 0 case day tomorrow, can Auckland expect to move alert levels, or will you stick to that 7-day plan?
Look, it will really depend on what, there's a whole lot of things that we'll be looking at. We'll be looking obviously at whether there are any additional cases when the Cabinet has this conversation, whether there are any additional cases, what what other warning signs or what other risk factors there might be out there that we need to consider. So as you'll appreciate, every time we've done this, people have wanted to sort of have some certainty earlier than is possible to give, and this is one of those cases where it will really depend on what information we have at the time when we make that decision. We do get information literally right up to, 15 minutes before we go into the Cabinet meeting. That's how up-to-date the information is we have when we make those decisions.
But Dr. Bloomfield, the Prime Minister said case L should have been isolating. The Ministry says she's wrong. Who has misled the public?
Case L was part of a family. That the original case was case I, the student who was a casual contact from the college, and had had very clear instructions, and the letters that were sent out by the school to all the school community, as I said yesterday, we're happy to make available, and there was very clear instructions in there. The instructions did change over time, but it was very clear right from the start that all students in the school needed to be tested, and the student in that family who had actually been symptomatic for a few days hadn't been tested by the Monday. And so I think the instructions to all the families were clear, and as I said also yesterday, we saw actually over 98% of students, including those who were from casual plus contacts from right across the school, had been tested before they went back to school on that Monday.
I think, can we just put, I think there's some very important context. We need to consider all of the context around this particular family when we're thinking about what they should and shouldn't have been doing. So very clear guidance was sent out to all of the families of the school on the 17th of February saying that everybody in the households should get a test. That was then repeated. There was further information sent out on the 19th of February. The two siblings started to show symptoms on the 19th and the 20th, and the person went to work on the 22nd, despite the fact that at that point there were two people in the household showing symptoms and no one had been tested. So the reality is there's certainly enough information there that the person shouldn't have been going to work. I think that's the point that the Prime Minister was making. I think it's a very fair point to be making. I think, information changes as risk changes. There was clearly enough risk here for this family to know that they should have not been engaging widely with the community.
Why did the Ministry of Health put on its Facebook page that the family had complied with the advice that they were given at the time? Why did you defend the family?
Actually, I understand that the Facebook post was on the Unite Against Covid-19 website rather than the Ministry's website. And that was a comment about the general advice that had gone to all families, without at that point the knowledge that indeed there were members of the family who had been symptomatic and should have been tested earlier than perhaps they were. I think the key point here is, and I'd like to bring it back to the comment I made earlier on and reiterated yesterday, actually anyone who is symptomatic should get a test quickly. And they should stay at home until they get that test. And clearly, in a situation where we have an outbreak like this, that also means that family members of someone who is symptomatic should also wait at home until that test comes back if they have been asked to be tested as part of a response to an outbreak where there are known cases of COVID-19 in the community. And that's the important thing for everybody to remember.
Do you admit that KSL was never told to isolate by the government?
I think you've missed the important information here. First of all, repeated attempts were made to contact this family individually. So 9 phone calls and 3 text messages to one of the cases from the 15th to the 21st, 6 phone calls and 3 text messages to another of the cases during that period of time, where advice specific to families' circumstances could have been given to them. As we have always said, where a member of your family, this is not new, where a member of your family starts showing symptoms, particularly if you are in that, you're in a category which is at higher risk because there's an investigation going on, of course you shouldn't be going to work or going and engaging with others.
That person has been vilified online because the Prime Minister said that they didn't isolate when they were told to.
Look,
they were never told to.
This brings me to another point which I have been making repeatedly since this investigation started, but also actually over the last 6 months or more, that pile-ons through social media and through other things simply don't help with our overall efforts here. We need people to be focused forward. Human beings are human beings. People do make mistakes. We want people who have made mistakes to continue to come forward. We can put the facts out there, but the kind of abuse and bullying that we see in the community from time to time isn't okay. It doesn't matter who the target of that is. It's not okay. It's not a constructive contribution to our COVID-19 response.
So will you apologise as a government for creating a pile-on, for creating bullying?
No, I don't think putting facts out there is doing that. I think how people respond to that, is up to individual people, and our message to them is that we should be showing kindness towards people who are coming forward.
With 9,000 vaccines.
Dr. Ashley Bloomfield, do you now consider that maybe it would have been wiser to put a Health Act order in place earlier on to really rigidly specify what these families needed to do and get a bit more coherency throughout this?
I'm not sure the presence of a Health Act order, which for most people wouldn't actually, they wouldn't either know about or understand, would have made a difference here. Again, having read the correspondence between the school, the messages that went out on 3 different occasions to the families, it was very clear. And again, I'll just come back to the fact that the communication from the school were really good, and you saw that in the response, that despite it being a very large school, that 98% of these students had been tested by the time the Monday came around when the school was reopened. So I don't think that the presence or not of a Section 70 order would have made a difference, and the school was being instructed anyway on the authority of a medical officer of health who is designated under the Health Act, so there was a legal basis for the requirements.
And can I just clarify, after the order, the order basically says that, from the 23rd you must stay at home if you're part of this community until a contact tracer gets in touch with you. What were the contact tracers saying to these families afterwards?
You mean from the 23rd of February? I don't know exactly, but they would have been saying what was the agreed script to the families, and so I'm very confident, and they're very professional, that they would have been saying the right things.
Home for 14 days, get a test, is that right?
We'll come back to you on that. I think about it.
There were more than 9,000 COVID vaccines administered to date. How many people have refused a vaccine thus far?
Look, it's difficult at this point because we'll kind of get a better sense of people who are turning down the vaccine once we get through the full border workforce, because of course in some cases those people just won't have come forward. They won't have they won't have made a time to go and get vaccinated. So we'll know more about that towards the end, once we get towards the end of this group.
Publicly saying every time there is an announcement about vaccines or an update on numbers, how many people have refused?
One of the things that we have worked through quite carefully is what we do around our border workforces who choose not to be vaccinated. It is not compulsory to have a vaccine, though we strongly encourage people to do so. We will be approaching this the same way as we're encouraging other employers to approach it, which is that it is acceptable where the risk profile warrants it to say that certain jobs can only be done by people who have been vaccinated. For our border workforce, that is what we will be saying. And our first response to those who have turned down the opportunity to be vaccinated will be to look to redeploy them to lower risk roles where the vaccination is not required to do that work.
Going forward, would you be publicly making those numbers clear about how many people have turned down the vaccine?
We might not necessarily be measuring it in that way, but we'll certainly release what information we do have.
At this stage, we are beating Australia on doses per 100 people. It's 0.184 to 0.162 or 1.163. Are you expecting to stay ahead of Australia, or is that possible?
Oh, look, it's very early days yet. It's not a competition. Ultimately, I think New Zealand and Australia, we both want to vaccinate as many people as quickly as we can. Supply is going to continue to be a challenge. One of the challenges that we want to manage carefully is we don't want to be in a position where we ramp up to the point where we can't sustain the number of vaccines that we're delivering and we have to then scale down again. So we'll be working our way carefully to make sure that we're doing this in a sustainable way.
Is there a timeline around a MedSafe approval of the other vaccines?
No, but I'm happy to provide a further update on that when we do have some more information.
Talking about Australia, why hasn't the government released a full breakdown of all the various groups which will be getting the vaccine and roughly when, like Australia has?
We're still working through a number of factors, which includes some of the issues that have already been asked about, including how many vaccines will we have available and when will we have them available. Ultimately, our goal is to get to the point where we're not having to prioritise as quickly as we can, and so The degree of prioritisation will depend a lot on supply. So once we get to the point where we can make the vaccine available to everyone, we'll be doing that. But we'll be doing it right at that point. And so we're not going to be at that point. So as we continue in a constrained environment, we continue to prioritise. So it will be a bit of a rolling maul, depending on what happens with supply.
Isn't it important, though, for public confidence in the program to have a feeling of when they might get a vaccine?
Look, we'll release in more detail as we can. I think what I've just set out for you is the prioritisation for the vaccines that were the 200,000 odd that we have available now. And as more vaccines become available, we'll release the information about how they'll be prioritised. Amelia.
Do you have the numbers on the close contacts and casual contacts who haven't yet been tested?
There are quite a few different numbers, so I think what would be better if we did is just make those available on our website. What I can say is we've had a very high degree of, well, everybody has been contacted in the close contact category for all the cases, and the only ones outstanding are ones where it's just timing of the test, because we do that 5 days after the exposure, certainly for cases M and N, and then a high number of the casual or casual plus contacts are in isolation, have all been contacted, and it's timing around getting and matching the result of the tests.
You cautioned that we weren't yet out of the woods. Given that we have another day of 0 new community cases, are you feeling a little bit more optimistic today?
Oh, I'm optimistic on every day, but look, as each day goes past, and I think the things we're looking for are, first of all, are there any cases identified amongst the close and casual contacts? And secondly, and again, I want to thank everybody who's coming forward and being tested. Those high testing numbers across the community just give us increased confidence that there's not undetected chains of transmission out there. So all the cases we have had so far, we have been able to clearly link back to these 4 families.
Joe.
Both yourselves and the Prime Minister over the last few days have talked repeatedly about learning the lessons from whatever mistakes, miscommunications, breaches, etc. there were. So what exactly is the lesson that has been learned from this case, and what information may or may not have been received, and what are you actually going to change or do about it to fix it?
Look, we're not at that point yet. Obviously, we want, whenever we deal with a case or a group of cases, once we are through the immediate response of that, and we're not through the immediate response of that yet, we will have a bit of a debriefing exercise, a look closely at what went well, what could have been improved if we had to do it again. Every time we've done this, we've done that exercise. So you'll see that we've handled things differently this time compared to August, when we dealt with the last large-scale community response. And we'll do that kind of debriefing again. That hasn't happened in detail yet, because the people who will do that are still currently focused on responding.
Would it be fair to say, though, that in this circumstance, given the amount of communications that were had, which appear to have had no effect on this particular family, that there needs to be a system perhaps whereby if it's been 24 to 48 hours and no communication has been received back from them, that perhaps it's a case of actually sending someone out to door knock? Because Dr. Bloomfield, you've said that 98% got tested. It was a small group of people you were talking about. Surely there was the ability within the Ministry of Health to actually send someone to that door.
Yes, and it's not the Ministry of Health per se, but the Public Health Unit that works with local providers. And in fact, some families had already been visited over that weekend prior to the day the school reopened. So again, there is, and I talked about this yesterday, absolutely things that we want to examine and see what could we have done differently, and see if there are any lessons learnt. We always do a debrief after any of these and a review and lessons learnt, and then we modify our protocols and processes accordingly.
Sorry, the light's not very good up the back there. I nearly missed you.
While the wage subsidy is available for people, what about volunteers who have been on the front line giving manaakitanga, food packs and such? What's the government doing to help them?
So look, anyone who is experiencing hardship as a result of the Covid-19 response, my advice would be contact Ministry of Social Development, so MSD. There are a range of different supports that can be available to them, rather than go through each and every one of them. In fact, I don't have the details to go through each and every one of them, but there are a variety of supports available, and people should really talk to MSD about what's going to be most appropriate for their circumstances.
Specifically there for volunteers, though, that have been at the front lines of these of the COVID in the community?
Look, it's going to depend partly on the other circumstances. So what do they normally do? Are they normally on a job seeker benefit, for example? Are there other financial supports that might be available to them? So the best port of call really is to discuss their personal circumstances with MSD, who'd be able to advise them on the most appropriate forms of support for them.
Is talk of vaccine providing the danger for some to feel complacent, feeling that there is light at the end of the tunnel?
Look, I think we can all feel there's light at the end of the tunnel, but the tunnel's still a very long one. So we're still going to be doing this for quite some time before we can really breathe a sigh of relief around vaccinations. This is still a very small number of people who have been vaccinated, and it's going to be some time before we're scaling up broadly. I think what it means is that people can see that progress is being made, but we're still going to have to do the hard yards over the next year until we get to the point where we've got a broad coverage of the vaccines.
2-week isolation payment.
Can I just go back to Craig's question? Like, has the breakdown or the order of vaccinations of Kiwis gone to Cabinet in any form, and what is the hold-up?
Yeah, so we had a good discussion about that on Monday, and that included signing off those first tiers that I have just mentioned. So the frontline border workforce, which we were already underway with, their families and whānau already underway with those. Signing off that next group of the health workforce went through. And so we've got a sense of the first groups of prioritisation. We are ready to, and we will probably do it shortly, provide a bit more information about the next tier, and then we'll provide more information beyond that. So we're working our way through the best. New Zealand's population is different to other countries, so it'll be a little different. You know, how we sequence things might be a little different to other countries. So there's not just and our circumstances are different. You know, we don't have COVID-19 spreading in the community. So what we want to do is really focus in on risk. So first of all, who's most at risk of getting COVID-19, and who's most at risk of having an adverse consequence if they were to get COVID-19.
Just on National's policy, will the government adopt National's idea to give workers 100% of their wage if they're forced into isolation? And if not, why not?
Look, we've put out quite a range of support to people who are needing support as a result of COVID-19, through the wage subsidy, through the income relief for those who are having to isolate and whilst they're getting tested, or staying home because they are unwell. So we've got quite a range of support available out there at the moment. I do note that the National Party haven't indicated how they would pay for these additional things that they're proposing.
It doesn't cover 100% of those workers' wages, though, does it?
No, it doesn't cover 100% of workers' wages, no.
So does it need to, though, is what National's saying? It needs to cover 100% of workers' wages if they're in isolation for 2 weeks. Your policies don't do that. Should it be doing that?
Look, we can't financially compensate every possible scenario for every person who's been disadvantaged as a result of COVID-19. What we're trying to do is make sure that we are spreading financial support as widely as we can to those who need it the most, so that we can all get through this.
Incentivising people to stay home.
Well, I think we are incentivising people to stay home by providing that additional financial support, including support to their employers, and we're asking employers to do the right thing as well.
You're asking employers to do the right thing, you're not mandating employers to do the right thing. So there's still a situation where people are more financially well off if they go to work while being told to self-isolate versus staying at home. Wouldn't it be pretty easy, given we're only talking about 2,000-3,000 people here, to just up the payment to at least the minimum wage?
Look, like I said, we're doing what we can in terms of providing a range of financial support available to people in individual, depending on their individual circumstances. It would be very difficult for government to compensate for every possible eventuality and for every possible disadvantage that people may be experiencing.
This is being forced to self-isolate by the government. It's not every single possibility. And when you were designing this scheme in March last year, clearly there was a possibility that it was going to be hundreds of thousands of people, a lot of money, but we're talking about 2,000-3,000 people here, aren't we? Is it reasonable for the government?
Look, we always continue to review things as new information comes to light, but at this point, we're not proposing to make any further changes.
So on the order of vaccinations, I mean, has there been some sort of? Has it not been released yet because you're now reconsidering whether South Auckland should be at the top of the general population?
No, one of the things that once we get into those more broader population discussions, that really comes into the question of what's our, how is our supply going to affect that? So sequencing for around priorities, which is the first bit that we've done, is really based on those core risk factors of people most likely to get it, and to be kind of at that front line of the risk there. The sooner we can get to the point where we're thinking about rollout for everybody, even within rollout for everybody, there are still going to be some decisions to be made, because we're going to, it's not going to be available everywhere on day one.
There have been calls for that South Auckland population to be higher up the list, basically. Are you considering that?
Well, the South Auckland population's already quite high up the risk high up the list based on who's already being prioritised, because by virtue of where they live, those people are typically living close to the airport, and there's a lot of people at the airport and working in and around the airport who are higher up the list.
At the general population level?
Look, we will release more information about that. That part of it has not yet been finalised, so we will release that information once it has been finalised.
Minister, could I just make a couple of comments here? One is, we gave some initial advice to the government several weeks ago on a possible sequencing framework, but more recently there's been much more specific evidence that we've collated from overseas about the specific risks for different groups. For example, it's clear that older age, over 65, is a very significant risk factor for a poor outcome, and we've seen that here. We've also got very much more specific risk information about people with pre-existing conditions like diabetes and cardiovascular disease, so we've updated our advice just recently to the government. The other comment I would make is one I made yesterday. The important thing is not when people get vaccinated, aside from our border workforce. It's that we do it in an elimination strategy, and it's when we finish, when we get the last person vaccinated, and so that is a very important driver for the rollout of the program.
Northland Mayors are saying that people should be able to travel through Auckland for work or travel. Would that ever be something the government would consider?
There are some provisions for people to travel, to transit through Auckland without stopping already. So there are already some provisions for that, but we continue to look at those. And if with us to go on for longer, then obviously we would again consider that. So people can transit through Auckland now without stopping, or get a connecting flight through Auckland, for example, if they're flying from Northland via Auckland. That's possible now.
Ryan and Hannah Tamaki left Auckland on the eve of the level 3 lockdown. They then travelled to Rotorua and led a large church service the next morning. They now say that they will be touring the country. Is that responsible?
I think it's completely irresponsible.
What would your advice be to those who may be meeting up with them as they tour around the country?
Oh, look, I would encourage everybody to exercise judgment here. Sneaking out of Auckland right at the beginning of a lockdown and then having large gatherings of people is simply putting people at risk unnecessarily.
A breach to the health order, and that means that Ashley Bloomfield, you're in charge of referring that to the police. So will you refer this instance to the police?
So the Section 70 order, which was the one I signed, was specifically for the second part of the response in the Papatoetoe High School community. Any breaches of the current order, which underpin the alert levels, are actually a wider government responsibility. But I dare say that they wouldn't be the only people who left Auckland on the eve of alert level 3. I'll just come back to my point I made yesterday. Actually, if we all do what is expected and required of us, and that includes wearing a mask in the right place, getting a test early, abiding by the level 3 restrictions, then we will stay ahead of COVID-19, and we all need to keep doing that.
Māori and Pacifica numbers being hospitalised are quite high at the moment, overrepresented, but what kind of conversations have you had with the Rōpū Whakakaupapa Mate Uruta on that, and how are you engaging a Māori Pacifica community?
I'll ask Dr Bloomfield to comment on that. I know that Health have been having extensive engagement. So
yeah, we have pretty regular meetings with the Māori Pandemic Response Group, and there's been a lot of input from them right from the start around the design of the vaccination program, not just around how we can make sure we get to those communities, and particularly, as you pointed out, because we know Māori and Pacifica have higher rates of hospital admission, higher rates of pre-existing conditions, how we identify those populations and give ourselves as much runway as possible, because as a system we haven't been as good at reaching those populations, so involving them right from the start, not just in the discussions around program design, but also in the rollout. And for example, the first vaccinators trained in Auckland for the rollout were from the local Māori providers there, so it was just great to see them involved right from the start in vaccinating.
What advice and recommendations have you received from them, and have any of those been implemented?
Look, I just can't remember off the top of my head, but I certainly have regular correspondence and requests for information, and I always enjoy engaging with them. But we can come back to you with any of the specific advice.
Jenna.
The Women's Rugby World Cup scheduled for September has been postponed, and a lot of businesses were banking on it. Was that a necessary move?
Look, I think that was not New Zealand's decision ultimately, but I think we have to acknowledge that for a tournament like that, there were some of the teams were going to be disadvantaged had it gone ahead within the timing that was proposed. There were a variety of factors behind that, including, the potential for teams to compete, and so I think it was probably a fair decision. We'll certainly work very closely with them to make sure that we can make the event a success.
September's a pretty long way away. Have we gone too hard, too early there?
Sorry, what's that?
September's a pretty long way away. Have we gone too hard, too early with the...
No, I think it was probably a sensible decision. Ultimately not our decision, but I think it was probably a sensible one.
I'm just wondering what other vaccines MedSafe's considering at the moment, and when you're expecting a decision on them?
The two vaccines that we've had formal applications for so far are the Janssen vaccine, and that's the furthest down the track. There's a lot of... I was talking with the team yesterday, the MedSafe team, to thank them for their work on the Pfizer vaccine, and I spoke to the staff who are getting rolling submissions on the Janssen vaccine, as we had with the Pfizer one. That would be the next closest one. I don't have a time frame for that, and we also have a formal application for the AstraZeneca vaccine. The information is a bit slower to come in from AstraZeneca, interestingly, so that's on a slightly slower timetable.
Do you have a preference for which vaccine people, in an ideal world, would everybody be getting Pfizer, or are you kind of agnostic to which vaccine they get?
Well, the comment I would make is all the vaccines that New Zealand has got the advanced purchase agreement on are showing really good evidence of effectiveness. We do know the Pfizer one seems to be a little ahead of the pack, so it's great to be in a position where we are already rolling that out to our border workforce.
So, would you be happy to just vaccinate everyone with that if you get supply?
Well, we've got 4 different vaccines in our portfolio, so we'll just have to see. And one of the issues around the planning and also the sequencing is around getting certainty of supply of whatever vaccine once they've been approved.
Sorry for the stupid question, but Australian. Once you vaccinate border workers, do you stop testing them for COVID each week?
No.
That continues.
Continues.
Dr. Bloomfield,
Mr. Hipkins.
Dr. Bloomfield, just in terms of any future cases where contact tracers repeatedly can't get hold of people, will you guarantee that those people will get a knock at the door?
Well, it's very difficult for me to guarantee that, but I think we have talked about the fact that we already, and have since last August, used door knocking to follow up people who we can't get hold of, particularly people who we know should be isolating and who are on daily phone calls. And those are the ones that we already send teams out to, or the public health unit does, usually local Māori or Pacifica providers, both to provide support and also just check in that people have had the testing and are isolating properly.
You've been very patient.
Just on the, Dr. Bloomfield, you say that the families of casual contacts at the school were required to self-isolate under a Section 70 order because the ARF's letter was from a medical officer of health. But the ARF's letter only said that people are encouraged to stay home until Monday. That's not exactly a requirement, is it?
The letter from the school, there were 3 different letters from the school, and they all had slightly updated information depending on the situation at the time. And I'd have to go back, but I think they have all been released or are made available. Yes, so I can't remember the exact wording in the most recent letter that they received. There were letters, I think, on the 14th, 17th and 19th, and then the Section 70 order came into effect from Monday, I can't remember the date. Yeah, the 23rd, yes.
That Section 70 order wasn't gazetted, and it was available on the Covid-19 website. How was it distributed to the people who it applied to?
Well, it's not, the actual order is not promulgated to the people who it applies to. It just underpins the instructions they are given. And prior to that Section 70 order, they were being given instructions through communication from the school that was based on the advice and requirements of the Medical Officer of Health at the Auckland Regional Public Health Unit, and that has a legal basis to it because it's an expectation and requirement from the Medical Officer of Health.
I would simply point out that the significant majority of people who are currently isolating at home as a result of Auckland being in alert level 3 won't have taken the time to read through the order that I signed that that puts Auckland into alert level 3. They'll be following the communications that have been put out there that sets out what we're expecting them to do.
Would it have even been possible to hold the Women's Rugby World Cup this year? I mean, would we have been able to get all the players and the officials through MIQ?
It would have been very challenging, and we were working with them to see if we could find ways to overcome those challenges. Those conversations were ongoing, and we were looking at a variety of different options. In the end, we won't need to do that now.
Setting up special MIQ facilities?
We were certainly looking at whether there were ways that we could sequence the arrivals so that they could train whilst they are isolating. We were looking at a variety of different things to make the tournament a success, had it gone ahead in September. It would be fair to say we had not concluded that process, so those conversations were live. I'm sure that those conversations were part of their thinking, but of course their overall thinking would have been looking at the global context of holding a tournament when some of those other teams wouldn't have been able to compete to the level that they would have wanted to.
Just on going back onto whether you 100% compensate people for staying at home for 14 days. If you look at the South Auckland community, which has been predominantly affected by a lot of these clusters, and you take into consideration that the amount that they get paid currently over a fortnight, they have, I think, less than $100 left at the end of it if you take Papatoetoe average rent into consideration. Should you not at least be thinking about whether those particular vulnerable communities like South Auckland should be getting a full payment so that they can actually make a decision to stay at home, because if they don't, they can't pay their bills?
Like I said before, we're not making any announcements on changes to the support that's available today.
They are vulnerable though, aren't they? So why not?
Well, like I said, we're not making any changes on that today.
Just a question for Dr. Bloomfield on the contact traces. You said that between the 14th and the 26th of February, contact tracers reached 86% of close contacts within 48 hours.
Yes, 87%.
What about all of the other categories of, casual plus contacts and that sort of thing? Are they reaching that target as well?
The target is around close contacts. So it applies just to close contacts because they are the ones who are at highest risk of having been infected. And you've seen this actually with this outbreak. We've had high rates of transmission within households. And in fact, only one casual plus contact, that was the student in the third family who was infected in the school. The only one of the many hundreds and over 1,000 students there.
Do they not have targets when trying to contact all of the other contacts?
There's not a specific target there, because remembering that, for example, if we think about the locations of interest, we publicise those locations and the times of interest. We send out a notification via the app, but then those people actually have to come forward and indicate and contact Healthline or our contact tracers if we don't have specific information about who they were. So it's not possible really to put a target in place. However, of course, as soon as we find out about those people, the instructions are the same as to isolate, and then we're in touch with them on a daily basis to ensure they're isolating and testing.
Gina, lucky last question.
That message from the Unite Against COVID page, to go back to it, that the family complied with all the rules, is that statement wrong?
I actually am not responsible for that statement on the COVID-19 website, and so I'd have to have a look at it and see the context within which it was being provided.
Well, look, at the end of the day, they were all asked to be tested, and none of them were.
From someone.
So they were all asked to be tested, and none of them were.
Minister, can
I did say that Gina's question was the last question, but you can have one last one.
Okay, just to clarify, is Friday cabinet meeting, is that the first time that you would consider alert level changes? You won't consider it before that?
That's right.
And could you implement them immediately then, like Friday afternoon, get Auckland out of lockdown?
We actually changed the law so that we can remove restrictions more quickly, but having said that, the decision we take on Friday will be based on all of the information, and sometimes we will make a decision or in advance of when we want it to take effect. So that's all hypothetical at this point.
But it could be as early as Friday afternoon.
I think that's probably unlikely, but it's possible. Okay, thanks everybody.